There may be some disruption in my connection. Sometimes there is electrical issue here. So if I'm disconnected, I'll come back. Just give me 1 minute or few seconds.
I think we can start. We have around 90 odd participants. Dr. Sarin, shall we start now?
Yes, I'm ready. Yeah.
Yes. Dr. Sarin?
Yes.
Shall we?
We can start, yeah.
So a very good evening to all the respected teachers and dear residents who have joined for today's session organized by the Spice Route India Movement and FPI. So Diploma Family Medicine students are a core group of residents that we are having over the last 2 years. And as you all know, the first batch is going to write their theory exam in December. And it is a quite important thing that they should be enlightened on how to approach the exam, being the first batch going to write the Diploma Family Medicine exam. And for addressing this concern, we have the best faculty, rather the best person to address their needs is Dr. Raman Kumar sir. He is the president of National AFPI as well as the convener of the Specialist Board in Family Medicine of National Board of Examinations and Medical Science. And over to you, sir. And I would also welcome other office bearers of Spice Route to this meeting and all the residents who have joined. Over to Raman, sir.
Thank you, Dr. Vishnu. Spice Route, the PG wing of AFPI, Spice Route. And thank you all diploma candidates. I hope my voice is clear to everyone.
Yes, sir.
Okay. So I've been part of the team that designed the family medicine curriculum for diploma program, as well as we also rewrote the entire curriculum for the DNB program. And essentially, I would like to discuss the difference between two. And what was the idea behind starting a diploma program. I know there are many other questions, but today for practical purpose we'll focus on examinations, because many of you are worried about what would happen in the examination, what would be the pattern of examination, what kind of questions would be asked. So these are the concerns I would like to address today. There are other concerns also related to other prospects and prospects of family medicine and things like that. But we will focus today on the examination part. So partially I'll be speaking about the theory pattern, as well as I'll be talking about the practical, how the markings is being planned by National Board. This was pending for some time. This was under discussion for past few months, and that is the reason it was not announced. And many times you would only come to know when the examination you see. But now, since we are there in the National Board, we are part of the National Board, so we are aware how things are happening and what you can expect in the examination. So our purpose of doing this session is to give you a kind of introduction to what would be the pattern of examination and how you can prepare best for yourself. Because I had a interaction with diploma candidates in Rajasthan, and many of them, they complain that they failed in the PAT examination, assessment examinations, and many of them have joined after several years of service. So how to read, how to prepare for the examination, and especially passing examination is important, essential. So our best intention is to have you all pass the examination first. So first I will discuss the pattern of the examination, little bit about the diploma program, and also what papers would be there in the theory, and what would be the marking pattern which is expected in the practical examination, so that you are prepared from your end and you can perform best from your own knowledge and skills. So let me first share my slides here, if I'm permitted. And if any of you have any questions in between, you can type in the messenger box. So will keep checking and keep a track on it. And towards the end of the sessions, if there are more questions, we will
Please
be doing.
sharing.
I'm sharing. My screen is visible to all.
Yes, sir.
Right. So the idea behind diploma program was a push from Government of India, Ministry of Health and Family Welfare, because there was a decision at Medical Council of India then that they would not want to run diploma programs like DCH, DGO kind of things, diploma anesthesia, DMRD, and they wanted to convert all diplomas into degree programs. This was the initiative of uh, uh, Medical Council of India. But then there was a concern from the ministry that in that case, if all people get MD qualification, equivalent qualification, many of the government position may not be filled at all. And also they wanted to do something for the in-service candidates, whereby they could get opportunity to train themselves for skill enhancement, for growing further competencies or further specialization. So it was a push from Government of India, Ministry of Health, that some form of diploma or additional qualification program should be initiated, especially for those who are in service of the state governments, and also those who do not get opportunity for doing full programs. And largely, as we know, everybody wants to do a clinical program. So mostly these programs are initiated. They gave it responsibility to the National Board of Examination in Medical Sciences, as we know, NBEMS. Now, earlier it was known as NBE only, National Board of Examinations. So now we have several diplomas. Our initial concern was, because there was no diploma in family medicine earlier. So what would be the, recognition status? So at the very first instance and meeting, we, pressed for it that if at all a diploma program in family medicine is initiated, it should be recognized properly by the Gazette of Government of India. So a Gazette was published by National Board of Examination with the permission of Government of India and with the consent of Medical Council of India. And before initiating and launching these programs, these qualifications, all including Diploma Family Medicine, were recognized by the Medical Council of India. They all are recognized now, as per now. The difference between other specialties and family medicine, that other specialties did have their diplomas earlier, like DMRD, DA, DO, diploma, DLO, DCH. But family medicine never had a diploma program. So it was challenging, but we were able to frame a curriculum for that. And if you have not looked at your diploma family medicine program curriculum, please do so, because I'm aware many of the candidates, actually most of the time, they are busy with their clinical duties, board duties and all postings. And first thing, you should look at the diploma family medicine curriculum. And we bring this session on the behalf of AFPI as well as Spice Route Movement. So I request you all, first of all, to go through this document of diploma family medicine competency based curriculum training program, which is of 2 years. So earlier I was talking about what is the difference between diploma and DNB. Diploma, basically we mean to say 2-year program, and DNB full program, which is of 3 years duration. The idea is that in diploma program, we do not burden the training candidates with any kind of thesis or research work, and mostly they should be learning practical things at the level they would be working, mostly district hospitals, community health centers, and those kind of skills should be, multidisciplinary skills should be acquired by diploma candidates. And so this is one of the difference. And largely, the smaller postings were reduced for diploma candidates, but conceptually, I would say diploma and degree programs for family medicine are same. For conceptual understanding of family medicine, you should also look at the curriculum of the DNB 3-year program, which is also available online. and which will give you, in greater detail of the each topics to be covered in theoretical part also, because whatever is there in diploma and degree, theoretically everything is same. So there's nothing that there is, reduced in terms of the number of topics, or the, topics that, child health is not, covered, or maternal health is not covered, or certain part of psychiatry or mental health is not covered. So pediatrics or antenatal to end of life care, all stages of life are covered in both. So from topic point of view, there is no difference. Training duration, thesis part is different. So first you have to understand. So also look at the DNB full, 3-year program curriculum for the list of topics, which are given in more detailed manner, list of topics. So first I will go to the diploma detailed syllabus. I'm sure many of you have seen. And as you look at this, table, it starts with newborns and infants, children, adolescent, women, elderly, disabled, and terminally ill patient. So we are covering entire life cycle. And this is how we have tried to distinguish the philosophy of family medicine in terms of curriculum and course, because this is life cycle care. It is not about, if you look at this terms also, we have not said gynecology or, obstetrics. We have not said pediatrics. We have not said neonatology. We have not said, geriatrics, uh, and we have not said critical care in terms of, terminally ill patients, or, topic wise also, these are all generic topics. And what we mean to say is that we are providing life cycle care. And in this life cycle care, mostly anything, any topic which is of importance in practice is important for theoretical part. And if you look at the, individual textbooks of each of the specialties like pediatrics, standard textbooks of, medicine or surgery or OBG, these are given in quite details. And many times all topics may not be very, very important in terms of, family medicine theoretical examination, because mostly what is common and what is important in family practice, those are the important topics. So I can give you a hint like from pediatrics or child health, if you want to look at 3-4 topics are very important. Number one is growth and development, for example. Number two is immunization in child health and through all age groups is important for family medicine training program, and as well as for the examination point of view. And common childhood illnesses. What are these? Gastrointestinal infections, upper respiratory tract infections. These are the common things that you would see in children normally. And these are the ones, nutrition related problems, malnutrition, or, obesity. These kind of topics are important for childhood illness. So if you cover, these 4-5 topics, these are, this covers your 80% of your, approach in theoretical topics. These are the important topics from the family medicine perspective. We have entire book, Nelson or, Ghai Pediatrics. You'll see, all topics in detail. But what is important from family practice, family medicine point of view is growth and development, immunization, common pediatric or infant illnesses, which are, of course, gastrointestinal infections. And whatever is mentioned, for example, gastrointestinal infection, you should be aware from clinical point of view as well as from the public health point of view. So, management of diarrhea is important to learn from pediatric angle, but also from the PSM textbook angle, where you have, rehydration, oral rehydration therapy, or IMNC guidelines. Those are the things you should try to integrate when you are preparing for your final examination. So these are the common examination, topics, the way you should try to prepare and focus on the common illnesses. And you go through this, topic, nutrition development, common childhood infections, behavioral disorders, emergencies, child abuse issues, which, patient may come to you. And these are the things we see in family practice. So in newborn, you see neonatal resuscitation, growth, development, nutrition, childhood immunization. I was referring to recognition and referral of common birth anomalies, common childhood emergencies. So, these are the topics you should be focusing on for even short question, long question, whatever types of. And these days, mostly the questions will be coming on some kind of scenario. So, entire focus of the medical education system in India is now shifting. Earlier, it was more about factual things, theoretical things. Now, it is all about how you apply the theoretical knowledge to your practical, you know, uh, practice, or practically how you utilize that information. So earlier there was more focus on information load. Now there will be more focus on how you apply that knowledge to your own, practice or practical scenarios. So you may expect more common practical scenarios like you see in USMLE, or clinical case based questions framed in a way like 71-year-old male presenting with retention of urine with a history of diabetes, or so what would be your approach from managing in terms of history taking or evaluation, diagnostic approach and management in community setting. You do not have to learn in details about the prostatectomy or prostate operations or steps of the prostate operation, but medical management of prostate, prostatic syndromes, BPH, all this falls, and they will often come to you, or even relieving of urinary obstruction. These kind of things you can expect. So questions mostly, as you look at the earlier DNB question papers for the recent years, I think Dr. Vishnu has the collection. It is also available at the SpiceRoute website. And you should look at those past 5 years question papers and see how the questions are framed. And you can expect similar questions framed for diploma candidates also. There would be no difference in terms of, the context or the conceptual aspects or list of topics for diploma candidates. So I advise you all to go to the SpiceRoute website, and wherever all links are given, or contact Dr. Vishnu, Dr. Serene, members of SpiceRoute and PG group people, and they will provide you with the question banks. And you should look at least past 5-year question banks and try to see how the questions are framed. Mostly this will come now in practical sense. So those of you who are working full time, many times we are worried ki we have worked long hours in emergency or wards. We did not get time to study. So try to link your knowledge, previous knowledge of your MBBS, and link with your experience during your diploma training program. And if you are able to produce that in written format, most of the questions you will be able to solve in the final theory examinations. So the theory examinations will not be all factual. This will be all case scenario based. And mostly you will be knowing those things. You have seen those things in your practical thing. Only you have to brush up it through your common clinical guidelines. If at all there are like hypertension, how do you, diagnose hypertension? What are the guidelines on the basis of which you diagnose hypertension? What are the guidelines for diagnosing diabetes mellitus, for example? And what are the guidelines for managing bronchial asthma, for example? And these are the common recent guidelines you should be aware about. And this can be international as well as national. And you should be able to quote those guidelines. And this is what is different from, postgraduate training assessment. Because in UG training, mostly you write from textbooks. You read Guyton, you read, sorry, not Guyton, I'm talking about Davidson, for example, for medicine, pediatrics, Ghai, and all those things. But PG preparation is basically about your practical experience, your theoretical knowledge from the past during recent revision also, but also on the recent guidelines. So focus on the common problems like I talked about immunization, I talked about growth and development, I talked about upper respiratory tract management in children, I talked about gastrointestinal symptom in children. So these are the common problems, and you should be aware about the common guidelines of these entities so that you can reproduce them in your final examination. For example, we are not talking about gynae, but we are talking women in terms of breast pain, breast lump, abnormal uterine bleeding, pelvic pain, premenstrual syndrome, menopause, and each of them can be your question in your final examination in theory. Osteoporosis, contraception. You see this list, and you can think about 80% of things will be covered from these topics only. If at all there is a guideline, you should be aware of that guideline, PG guideline, and you will fare better in your final examination. And mostly from family physician point of view, you should organize your answer writing in a way that it reflects that your training is from family physician point of view. Many times we are aware about the treatment part only. Treatment part is medicinal management or drug management, and we are focused only on the drug doses, duration, and sensitivity and those kind of things. But from family physician perspective, certain topics are important. Certain approach is important. For example, when you are managing a patient, when you write management, you do not start right away with drug management. You start with with counseling, with diet modification or advice counseling, physical activity counseling, lifestyle modification. These all are true for all non-communicable diseases, for example. But all these headings should appear in most of your topics. Family counseling, right? Family assessment, nutritional assessment, all these topics, you can put it on most of the topics what you see here, and you need not straight away reproduce entirely as it is from the textbook that you are referring to or reading at the moment. So your family medicine approach, even it should, your answer should extend at least, if you even if you've just written the just the title of for example rehabilitation, you are managing stroke, you must mention about rehabilitation, physical rehabilitation, mental rehabilitation. And even mentioning this topic is very, very important from the answer point of view. So it should not be just about streptokinase and thrombolysis or primary PTCA or elective PTCA, or elective angioplasty, those kind of things. Procedures are important, but from family physician point of view, I remember one of the questions from my own examination where we were asked to explain in your theory exams. It was a long question. How do you manage chest pain from home to hospital? So somebody is complaining chest pain at home, and now you take that patient to hospital. So all these scenarios are different. One scenario is patient at home. One scenario is patient is presenting to you at your clinic. And another scenario is when the patient reaches hospital. So all the possibilities, differential diagnosis, chest pain primarily because neither cardiac in origin, but then that is first thing. Other things you should be considering. And if you write the practical things that you will do, you will pass your examination, and you will also have sufficient content. It not be necessarily, as I said, be hardcore textbook material that you need to produce, but your approach is very, very important. For example, as I discussed, from home to hospital, management of chest pain, and similar case scenarios will be presented to you for your practical and theory examinations both. And theory examination now, as I said, even for MBBS, the approach is on practical questions or case-based scenarios. Same is true even for NEET PG or future as it is planned next. Similar case scenarios will be asked in your theory examinations also. So if you look at now, if you go down, we look at the elderly, comprehensive assessment of older person, unique problems like fall, so prevention of fall, incontinence, delirium, dementia, common disease of elderly, prescribing in the elderly, polypharmacy, recognize and address social problems of elderly. So social security, their income, nutrition, family structure, family support, all these things are important in the elderly patient. And these are topics. But if you look at the geriatric perspective, it is more detailed. But these are the topics, if you are prepared, what is given in your diploma syllabus, you will be prepared more than 80%. And DNB is just pass and fail. So your approach should be to prepare at least what is given in your syllabus, common problems. And these problems, I will also give you advice on what book to refer, if you are approaching your examination in a couple of months. Because if you go through the different textbooks of different specialties, it is very time taking and difficult to revise, right? So use practical things, what you've learned earlier, what you are learned during your day-to-day management of cases, uh, common clinical guidelines, recent guidelines, and approach as a family medicine expert, which is multidimensional. It starts from dietary counseling to rehabilitation, and clinical management is part of it, right? So similarly, palliative care, communication skills, and all these things, basic, pain management, basic assessment of palliative care, all these things are important. So all these topics are important. If you want to be more detailed on topics, you also visit the DNB program topic list. You'll get these topics in more details, which will help you on your final theoretical examination. And as I said, family medicine approach to each topic. So management of hypertension remains same. The clinical, standard clinical guidelines are same for everyone, be it, MD medicine, DM cardiology, or MBBS. Everybody should be using the same guidelines. But in family medicine theory and also in practical examination, your approach should be based on the foundation of principles of family medicine. So you should, whenever you are writing any question from any clinical entity or disciplinary background, always remember the principles of family medicine, which is person-centered care. Person-centered care is every person is individual. Like, my spectacle powers are unique to me, right? Because if I use a lesser power or a higher power or different power from my own eyes, I will not be able to function properly. Similarly, if I cannot exchange it with other person, although the basic principle is to use or correct myopia or hypermetropia, but the individual power of each person is different. Even two person cannot change their spectacles. So the management of hypertension of each person is unique, age is unique, gender is unique, other comorbidities are unique, and socioeconomic status are unique. Status and complexity of hypertension in itself, the way it is presenting, the stage it is presenting are unique, and each person requires a customized care program or plan, which is person-centered care. So when we are talking about hypertension, we are talking about person-centered care, and we have to use this terminology as person-centered care. Understanding of the context of the illness, right? If somebody comes to you with hypertension, I mean, also I'm giving some, background of, thinking, so that you'll be able to write it in a proper way, even if you have not, you need not be very, very, bookish in your knowledge. So understanding the context of the illness. Now, somebody who is coming to you at the age of 70 with the BP of blood pressure of 170/90, is age-related illness. But somebody, 32-year-old male coming to you with, BP of 180/120, something different. Our common bookish knowledge tells that, you have to look for the renal stenosis and other factors which may cause early age hypertension. But from practical purpose, you have to take occupational history. For example, I practice in an environment where we have large number of IT workers who are working on day and night shifts. And I have observed that, many of them who are working in night shifts for longer duration are getting early diabetes and hypertension. So occupational stress and history is one of the most important part of management of hypertension, which is disturbance of the homeostasis of the body. So what is causing it? Sometimes we notice that, people in their 40s, they are fond of, or 30s, fond of, having extra salt, excess salt. So, dietary intake of salt is important. So these contexts, their dietary pattern, kitchen habits, food pattern, their occupation, these things are important from the management point of view of. So if you want to reverse or treat diabetes, it cannot be only antihypertensive classes, classification, doses, or appropriate choices, but also occupational part. And this is understanding the context of the illness. Health promotion and health prevention, disease prevention. Of course, we all learn. It is important to learn the national health program from the public health perspective. There is one paper on that in community medicine part. And the two things, hence promotion, mostly you have to read from theoretical point of view, from the PSM angle, because mostly you will be assessed by the PSM people. So health promotion topic you should learn. Disease prevention is again at individual level, what we do health checkups commonly. So common, preventive health checkup guidelines are there, and in which 4 components are there. For example, uh, screening of disease is one part, vaccination is one part, chemoprophylaxis, for example, we give aspirin for prevention of CV or cardiovascular and CVD diseases. Chemoprophylaxis is one part, and lifestyle modification, like smoking, alcohol dependence management, sleep disturbance, sleep deprivation, management of stress and fatigue. All these things are also important in health promotion and disease prevention. So health promotion is mostly done at the public health level, large, but disease prevention can start from individual, which we see mostly in our clinical practice. And also you see next topic, seeing the practice as a population at risk. So like I said, population at risk, the population that we are serving. For example, if I'm serving, IT workers, young people who are working in shift and working in long duration, working from home, they are a population of at risk for certain diseases, occupational as well as lifestyle, as well as, their habitat. So this is how you look at population risk. And we have to be collaborative, coordinate, and team-based care. Many times, if somebody comes to you with chest pain and MI, then you have to manage it. You have to, diagnose it as is gastritis or MI. If it is MI, then you should be the resource who should be arranging a referral or proper assessment and early, intervention, cardiac intervention, if at all is required in the nearest facility, be it urban, rural, wherever you are located. So you have to work as a team. Community-based care, this is very, very important perspective. So management of hypertension in hospital, mostly they will end up in complications. But management of hypertension in community is different, because many times they will come with elevated BP. Even sometimes when you are, for example, in my practice, we check blood pressure of all patients, all age groups, all the time. We check weight and BMI of all patients. So many times patients come with fever, but they also have elevated blood pressure. So community-based care is always also about screening all the patient, and how do you manage when somebody comes with 180, 110 pressure, and how important it is for you to manage it the way you manage it, and what are the guidelines exactly. You may be very confident in managing, but you should also be mindful of the guidelines that are given for referral, for hypertensive emergencies, hypertensive urgencies. What are these terminologies you should be mindful and you should do adequate. So home-based care is again, important, because for large number of patients, palliative care, elderly, bed-bound, post-operative care, all these are scenarios where, patients are homebound in your community, and home-based care, what you provide, especially in palliative care setting, this is very, very important. So palliative care and home-based care go right together. And these days, also many doctors have started to take home calls also, even for, times people have, very high-grade fever or, disability, which they are not able to move out of their homes. They want consultation digitally as well as physically. Importance of subjective aspects of medicine, because same subjective means, how the patient perceives the symptom or the illness, the same pain may be different intensity, as experienced by a different person. So these are the conceptual aspect I'm talking, and you have to apply them when you are writing your theory questions also, and it will make your work easier, right? Resource management and health advocacy is a common problem. If in your community, there is problem of animal bite, dog bite, for example, if in your community, there are rising cases of dengue, if your own community, you start seeing patients of COVID, something new in your, you have to do advocacy, or reach out to appropriate authorities and persons for right type of community based or population based intervention also. And this is also important. This is being especially given in diploma program, but also in detailed in the DNB 3-year programs. Common symptoms, approach to a person with abdominal pain. Now you may get a case scenario of 40-year-old male, 25-year-old female, constipation in children, constipation in elderly, constipation in cancer patient. So these are the case scenario you may expect, and you have to apply all those principles of family practice as well as your clinical document and the clinical management plan. All these topics: diarrhea in children, diarrhea in diabetic, chronic diarrhea, acute diarrhea, with all the history that is being build up into a case scenario, and you have to apply and frame your answer according to that. Dyspepsia, what are these terms? And mostly it will not be all out and out theoretical. It will be mostly case scenario based, as you will see the recent question banks of the DNB programs, because earlier we did not have any diploma programs. Nausea, jaundice, cardiovascular, respiratory, as you see. So symptom based approach, because this is, you have to understand, it is not the inferior level of care, because when patient come to you in family practice, they are undifferentiated patient, they are undiagnosed patient. So patients come to you with abdominal pain. This can be appendicitis, this can be renal colic, this can be pancreatitis, this can be diabetic nephropathy, this can be something related to gynae issues in females, or related to menstrual problems, or ovarian cyst kind of things. So what question, whether it is a female patient, whether it is an elderly patient, or a diabetic patient, or a child, you have to understand the context of that clinical scenario. You have to write your answer according to that. So you will not be right away asked about abdominal pain or diarrhea. You will be given a case scenario or a situation or a context where you will be asked. So if you prepare all these common problems, keep in your mind from your past experience and your DNB training, what all cases you have seen. And if you remember or able to articulate that experience in your answer sheet, keeping in mind with the core concepts of family medicine, you will be able to, not only you will have a ready-made material to write for every question, but also you'll be able to pass the examination. Even if you mention the headings, if you are short of times, you should mention chemoprophylaxis, for example, or rehabilitation, for example, or diet advice, for example, physical rehabilitation, physical activity, counseling, family counseling. All these things are public health initiative. It all is required. All these things, headings, even if you are able to mention, you will have ready-made material where you will be able to answer the questions. But these are the questions which are in front of you, right? So you have to go only through your syllabus. If you prepare your syllabus well, you'll be happy to. For example, if you look at the central nervous system, IENT things, hoarseness is one symptom, hoarseness with a history of particular, then you have to, think from your own experience, if you've seen any hoarseness case, what are the common headache problems that you see in your practice? Migraine is one part of it. Management of migraine is one part of it. When headache is, requires a referral, what other things can cause headache in DD? For example, headache could be also due to hypertension. It can be due to elevated blood sugar level. It can be due to dental problems. It can be due to sleep deprivation. So when you're thinking about headache, and if a case scenario is given to you, it is important that you link up all these things and able to synthesize and write your answer. A new pattern is not difficult. It is rather easier for anyone to approach if you've worked, if you're experienced, if you're already done in MBBS, if you've already been working for some time, if you have also done 2 years of additional training. Most of the time, most of these cases you've already seen in your practice. It is nothing new. You're not an MBBS student anymore. So all these topics are your questions, right? Common symptoms, and earlier we went through the age-wise scenarios, like this is specific neonatal to terminally ill patients, ranging from children, adolescent, women, elderly, disabled, terminally ill patients. These are your topics for questions, and again your approach for the questions I have mentioned here. And now the common symptoms, and again these common symptoms, social issues, infectious diseases, skin problems. So skin is so broad, but these are the topics you will be expected at least to know and answer. Questions to write is skin ulcers, hair and nail disorders, right? And sexual health, erectile dysfunction, disorders of prostate, as I was discussing earlier, and medical management, when to refer, STD, infertility, lumps, scrotal pain, disorders of pain is contraception. Contraception is again very, very important. You should be thoroughly understanding, starting from emergency contraception to long-term contraception, options available for couples, and common chronic illnesses, as we all know, allergy, asthma, COPD, epilepsy, hypertension, diabetes, dyslipidemia, ischemic heart disease. These are the common things from the point of view of questions being framed. But always remember that you will see questions from clinical scenarios. Now, these are the 4 papers which you will be getting in your final examinations, and it is almost similar to DNB 3-year program: medicine and allied sciences, surgery and allied sciences, maternal and child health care. Maternal and child health care is part, gynae and pediatrics, but also, you have to link up with the public health initiatives, public health programs on maternal health, even child health, so nutrition related national programs, or, for example, Janani Suraksha Yojana. Part of it is gynae. You may get questions on gynecology, but also related to the programs, which is of course part of the last part, community medicine, or public health, where you are mostly expected to write about the programs, nutritional issues across what we have already in MBBS level only. That is sufficient. So these will be the 4 papers, and look at the structure of questions as they are given previously. There is a discussion that we may call the 4th paper as family medicine and public health, rather than only community medicine, because if you are assessing family medicine, at least there should be 1 paper on family medicine heading. So this is what suggestion we have given, but at the moment this is what it is. It may change this time also. Only the heading, the content remains same. Family medicine approach, of course, you have to apply to all these scenarios. Sorry, we have 10 more minutes. Now I will go to the worksheet of the marks for each of the components, for the final examination. This has been proposed. There may be minor. This is about practical examination. The theory part we have covered. I'm also giving you some idea about how the marking system is being proposed at the moment. There are some modifications proposed. So, there are 5 sections given in the practical examination for diploma program. This is a proposal which has been accepted as such with minor modification. But this is how it would be like I'm expecting. When I'm speaking, I'm not speaking on behalf of National Board of Examination. I'm there, so I'm aware of few things. But things may be slightly different also, but this is would be, what we expect, a general pattern of the practical examination. So one section would be medicine and allied sciences, where you'll have two cases, and allied sciences, dermatology, psychiatry, but most examinations are held in medicine department. So you may expect two medicine cases, and the marks will be total 100, and 30 marks are dedicated to Viva Voca examination. So 35 for each case, and 30 marks for Viva. So total 100 marks are dedicated to medicine and allied sciences. Now we come to second part, which is surgical sciences, which includes general surgery, orthopedics, gynae, ENT, eye, where we have, at the moment proposed only 25 marks. There will be one case. So any of these cases may come. Mostly there would be emphasis either on general surgery or on gynae. Those are the cases you will be expecting on this. There may be one case of 25 marks. There is no Viva marks allotted here on this part as of now. Then the pediatrics has been given 75 marks. Two cases have been allotted. Case 1 and case 2, 20 marks each, and 35 marks for Viva. And C is done. First part is medicine and allied sciences, 100 marks. Second part is surgical sciences. Third part is surgical sciences, 25 marks only. Pediatrics is 75 marks. Community medicine, Viva only. There is no, cases here. So mostly 50 marks for Viva here, and part A and B are given. 25 marks is discussion on national health policy, health programs, health legislation, etc. Discussion on health indicators, community health delivery services, vital statistics, promotive and preventive medicine, etc. So this would be the main headings of your Viva in practical exam. And then additionally, there is 50 marks allotted to family medicine Viva, where you have discussion on morbidity pattern, record keeping, family clinic setup, 25 marks. Discussions on emergencies, ethics, referrals, CMEs on 25 marks. These are all Viva. There's no specific cases, clinical cases as such. So, and grand total is, you can just calculate. D and E are 50 marks. And before that, you see 75 and 70, 25, 100 marks. So total now you see 200 marks. And here again, 100 marks given in medicine. So total 300 marks would be there. And you have to achieve passing marks in these subjects. And mostly these are hosted by either community medicine department or general medicine department in the absence of any family medicine department. So it depends where your center is. It may vary slightly. We have proposed little changes. I'm not sure whether they will be applicable, but what we have proposed is that instead of calling community medicine separate and family medicine, we have asked to combine the two into one heading, which will be called family practice and public health, instead of being called community medicine. But the content more or less will remain same. So, the total marks all remain same, marks allocated remain same. A slight modification we have also suggested on the surgical sciences, because gynae part, there is no cases for obstetrics, which is very important from government's perspective. If you look at, there is no obstetrics. So maybe this pediatrics part may be renamed as maternal child health. The marking will remain same, and the gynae part may be removed from here. So this pediatrics may be called maternal child health. There are two cases, one for child, one for mother or maternal kind. This may happen, may not happen this time, but this is the current scenario of marking system. It may change in future depending on what feedback is given. So we have very limited role on influencing the decisions of national board. Mostly these things are prepared by their own experts or other, patterns of the other specialties. But what we are, trying to give it to you is that you have an idea. You do not go blind when you are appearing in the examination. So so I can see some comments. I'll show that comments.
Sir, thank you, sir. The main
Yes.
concern is this, as per the latest notification that has been put forward by the National Board for the Diploma Students Examination, the
Mhm.
Diploma theory paper is having 3 papers instead of the 4 in DNB.
Mhm. So
That is
most
the
likely, I'm not exactly aware about it, but most likely the last 2 papers will be merged. Last 2, components may be merged, and I'll try to find out, more detailed what exactly would be topics if it has, been already announced notification. But last 2 papers, because medicinal science is one, medicine and allied sciences, surgical and allied sciences, and other family practice, maternal child health, maybe, merged into one part. Any other questions? You can read out. I will answer them if you wish to. Otherwise, I can go through the chat also.
question is regarding the status of the secondary DNB after the post-diploma DNB
Right.
is
So
right.
this is a different plain question because we are discussing today about the examinations only. But what I can say at the moment is that earlier there was no diploma in family medicine, so there was no discussion on secondary DNB. There used to be secondary DNB, but entrance criteria was different. Those were, like, PGDFM by IGNO and FCGP even many times earlier years. But now that there is diploma family medicine, we have already proposed this to national board. We are trying to, but for this to start, there has to be a accreditation process, and hospitals will have to apply. And when, there are numbers which are available through, postgraduate seats, then this may take, this may not come immediately, but within a couple of years we can expect it.
Thank you, sir. Just one more question. One question regarding the practical aspects. The DNDs are having the OSCE as well as the ward rounds. So, will there be the OSCE and ward rounds for diploma students?
So the current scenario I have already given you. It is a case kind of situation. What have been given to us for now is a case based, and I did not see any OSCE for now. If there is any change, I'll just try to find out.
Next is a question regarding books to refer for theory exam.
Okay, so for any book, because there are multiple books, I'll give you a practical advice because I've seen many test books. I've seen many international books. I own most of the books in my own, library for reference. But for, diploma candidates, my advice would to go with this book for now. I'm especially giving it for those who are appearing immediately after a few months. This test books, covers, in the present scenario, most of the topics in a family medicine manner, the common, clinical topics, as well as, you may need to supplement the public health or community medicine part, which you may cover from, Dr. Jugal Kushore test book or Park test book. But, you can make a foundation from here, and whatever you have read from other specialty test books, you can support from there. This is not a very popular book among the DNPs and PGs, but for practical examination, from my own experience, I am, I'm advising that you take one book and then build upon, your knowledge base on that. It will be easier to revise most of the topics from this book. If you see, which is, in your own syllabus, the topics which are not covered here, you can do additional reading, or you can take notes from additional resources. But this is my suggestion for theory examination, to go for one book, only one book.
Yeah, that is. I would also agree to what Sarah said. For reasons of people who are writing exam in December, you have pretty less time now, less than 45 days, I suppose. So you shouldn't be going with multiple books. Rather go with one single book. And for people, if at all any first year who are not writing the exam now, but later, maybe you can have one of our family medicine textbooks like Murtag, or uh, basically go with Murtag, which is one of the book I would suggest, as well as the.
Yes. So that you should use as your reading book for your training program. But
And
for
also,
examination point of view, exam also you can refer from there. All these topics you'll find there also. But for the purpose of Indianness of family medicine, because all your examiners who are setting questions or who will be coming in Viva, they will have Indian mindset.
there is a question about Rakel, but yeah, as we said, Rakel is also an international book, which
And it
is
is
not the right time to being a
right.
exam going candidate in December. It's never advisable to starting with Rakel at this point of time, because it is very elaborate.
So if I've
Maybe
read
at this,
through Rakel or Murga, you are free to revise through it, and you see your topics match your topics from your syllabus. And if you write from anywhere, there is universality in knowledge. Wherever you quote, it should be standard material. That is it. But not for the exam. If you started reading now, you have not read through 2 years, you do not start the standard textbooks now. Maybe for future, keep on referring and reading.
regarding the practical exam, we will have a discussion later. Currently, we'll just focus on theory part now. That seems better. Practical, we'll discuss later maybe. So any other questions that need to be answered? The 2022 batch, maybe by July you can expect your exams too. 6 months prior to your course completion, maybe 4 to 5 months before your course completion, I think you can expect your exams. Right now, sir?
Yes.
And there's some practical, any other questions? This I'll give you, just want to sum up the idea of, how you're on the day of examination, how things will be. Just I want to brief. You will be having 10 questions. If you have referred the DNB question papers, you'll have 10 questions, and you'll be given an answer booklet with 50 pages. Okay, 50 pages in a landscape format. Okay, which will be a rule booklet, and 5 pages will be marked for writing each question. You will have the question number on top of each page. So it is a 50-page booklet in landscape mode, ruled papers with 5 pages allotted for each question. Might be each question may have sub questions, so you have to divide your space accordingly, and that is the way you have to write the exam. You cannot write beyond that 5 pages. That is the most important thing. One thing. Now I have another question regarding the exam centers. Mostly what is happening now is the theory exam centers will be mostly in and around your state, but the practical exam centers nowadays you are not getting in your the state where you are studying. Okay, mostly it will be outside the state of your present institution. That is a current standard that is being followed by DNB. Only during the COVID period we had this exam centers in the same state itself. Otherwise, it is outside the state you are studying. Any other question? Yeah, there is a question regarding, sir. In every question that is being asked, at the flag end of the question, there is a 2 marks or 3 mark question. As a family physician, how will you approach?
I've already answered that. You
Yeah,
you base your understanding from the foundation or principles of family medicine that I discussed in the earlier part of the talk. And important from the family medicine, one is how you manage in community, how and what are the principles that you apply. And common management does not include only the treatment part, which is the medicinal or drug part. You also to focus on physical activity, counseling, management, hospital management, even the part of it, and also rehabilitation in community once the patient comes back to you. Uh,
now that question answer. Okay, so continue.
so if you want to learn the community
So
approach of
there.
family physician, then you have to refer to international books.
So regarding the answer precisely about whether you have to categorize based as differential diagnosis, signs, symptoms, it comes in two ways. The question can be asked in two ways. Most of the questions that have been asked these days are structured into different sub questions. So if it is asked as sub questions, you may have the different parts like the signs and symptoms otherwise in the separate sub question itself. In that case, you can write according to the sub question part. If it is a single question, like you are asked a broad question, a 10 marks question, you have to categorize based on the clinical features, differential diagnosis, symptoms, signs, management. And at the end of it, every question, irrespective of it is asked or not, you have to approach it in a family medicine perspective. It might not be mentioned in the question that how will you approach as a family physician. Even otherwise, you should be attending the question in that manner. That is important. And regarding the community medicine, just like sir said, the paper 4 these days are not exclusively coming as community medicine. Rather, it is a combination of family medicine questions are being given more weightage along with the community medicine part. And community medicine part, more importantly, it's being focused on the epidemiology statistics part. And more than that, the national program and related things are more focused coming to the paper 4 section. And family medicine, core family medicine topics are increasing. Coming to the diploma family medicine, the first exam is going to happen. But coming to the from the observation that we had from the DNB examination, paper 4 is now more focused on family medicine rather than core community medicine. And community medicine preparation part regarding the national program and most important epidemiology and statistics, you have to refer the park or whatever a book you have regarding to community medicine. And the national health programs, I would suggest you to refer the national health Ministry of Health and Welfare guidelines on the various national programs. You should have a brief idea about the various national programs. So that is important in preparing the community medicine part, where you have to give importance to the national health programs, epidemiology, and the statistics part, which is mostly coming for your exam. And some questions have been asked about the question papers, and I think I have made a compilation of the last 12 years of the DNB question papers, which I have already uploaded in the Spice Route India uh, FPI PG group. But if any of you are not there, if any of you are not there, maybe I have put up my number in the chat box, or you can contact any of your friends. I'll let you in the group so that you will get access to all these things. So any other questions? Regarding the journals, what I would suggest is the Indian journals. We have the journal of JFMPC, the Journal of Family Medicine and Primary Care, and which is more of scientific articles. And if you want a journal to look for in terms of theory, which covers theory aspect also, I would suggest the American Academy of Family Physician, AAFP journal is there, and also the RACG, that is the Australian Family Physicians Journals. And AFP, only the last 1 year article is paid one. All other articles you it be available for free, and it has almost all the core topics being described in a family medicine perspective in beautifully in detail. Dr. Sarin, can you please make more Raman sir the host? I think co-host. He is not, by mistake he has left the meeting.
Sir, you can unmute once.
So that is about the journals available. AFP. What about, there's a question, what about the passing rate as it is low in DNB exception from family medicine, DNB family medicine prospects? DNB family medicine, coming to the pass percentage, I would say over the last 3 years, data have been scrutinized. It's almost 80 to 90% is the pass percentage in DNB family medicine. Diploma family medicine, it's yet to be finalized. So how only once the first batch give the exam, we can know. Yeah, the Himani, I have posted it today also. Again, today I have posted the question paper set again. Maybe you can have a look. Health programs link. Let me see what I can do with that. There is a question in YouTube chat regarding UpToDate app. Yes, UpToDate is a material, but it is a vast material, I should say. But you should know yourself how to limit using the UpToDate app for our perspective, the family medicine perspective. Otherwise, you will be just wandering with so many topics on board and reach nowhere. That is the problem when you're dealing with UpToDate app. UpToDate more of just for getting any clinical for a particular question, any guidelines or an algorithm or kind of things. Maybe you can refer UpToDate. Don't sit with UpToDate and spend much time on it. It will be taking away a good amount of time of yours, which you have to actually use for preparing other things. Dr. Ajit, I didn't actually get your question. AFI membership to club the family physician and cater their issues. What is that you meant actually?
This is the purpose of AFPI, whatever at the level of whatever level you are, whether you are PG, you are pass out, where you have started your practice, you are practicing, you are looking for job, or you are doing job for a long time. The idea is to bring everyone together and share our experiences so that everybody benefits.
So regarding the AFPI membership, I'll just Dr. Himani, I'll update. We had put up the update in the group. Once again, I'll put it up today after the session. How to enroll in AFPI and all those details I'll be putting up in the group today after the session. Any more queries regarding the exam part? So I think you had a good discussion. I will just summarize. So you have a very beautiful curriculum with you, which I have again uploaded in the groups today. So what you need to focus is, nowadays most of the questions are being symptomatology based. How will you symptomatology based scenario questions, and how you approach everything these questions in the family medicine perspective. That is the way the questions are being asked. There is a big change the way of questions in family medicine specialty over the last 3 years, because the question setters have become more focused, and it's very beautifully framed over the last 3 years. It's not like some theory, you can write that. More than that, you have to have a family medicine perspective in answering every theory question. Each and every theory question being asked, you should be attending in a family medicine perspective, and you have to concise yourself in the limited time. You have only around 15 to 20 minutes in answering a single question. For people, maybe some people are from service, they'll be out of touch with the exams or the long time. So I just want to make it very clear, the you have 180 minutes for answering the 10 questions, which means you have only 18 minutes to answer a question. So roughly, to take it an average, 15 to 20 minutes is what you can spend for one question, and 5 pages what is allotted for writing an answer. So please make sure these things are taken care of when attending. And there, regarding the question about family medicine examiners in practical exam, so what is happening recently is, previously there was mostly from other specialities, but now the recent exam that from last 2-3 years we had one family medicine examiner mandatory for in all the exam centers. And in the recent exam that happened last month for the DNB family medicine, there were 2 family medicine examiners in all the centers where there were exam was conducted. So more number of family medicine examiners are coming up. So in that manner, the family medicine perspectives are taken care of in practical exams also. Sir, anything to add from your side regarding this, sir? The family medicine examiners in practice?
I think mostly your center would be one of the training centers wherever training is taking place. So the idea is now, one of the problems that, examiners earlier were judging or assessing the students based on their own specialty experience. So that is the idea, is to, enhance the number of or participation of family medicine trained faculty or examination. This is happening, as you mentioned, and this will continue till in future. We have, more family medicine faculty available everywhere. At most of the places nowadays, we have at least one family medicine trained person. So, you'll have them, and like you said, idea is to have at least 50% of the examiners as family medicine experts, not without them, at least.
And
but you can always expect other specialty people available, but most of the time they would be, cordial, and they will not be, at earlier, the experience was different. But now, recently, what I've gathered from the candidates is that they get a cordial involvement.
And any other questions? Can diploma family medicine be considered as examiners in future? I think that questions time need to answer. We have time, at least you need to have
Previously,
around.
it depends number of people who are available, and with their experience, there is certain criteria for your teaching experience. When you are a teacher, then only you can be a examiner. So, that rule applies. This is important in terms of recognition by medical council and NMC, how and who are the examiners are.
I think most of the questions are answered, I suppose. I think I hope there are no more questions from any of the candidates or residents. So the questions are taken.
Of course, diplomas can join family medicine as SR, because there is dearth of DNB or MD everywhere, and many places, if departments are initiated, diplomas will get opportunity to join as SR.
The center, the center for practical examination I have already answered. The center for practical examination just comes 10 to 15 days before your exam date, and it will not be in the same state where you are studying. It will be in some other states. You'll be having the exam center. And one more thing, since the diploma students numbers are in plenty, we have around 200 plus diploma students giving the practical exam. There is high possibility that it will be conducted as 2 batches, like what is happening in medicine and OBG and pediatrics for the DNB students. So it is not conducted in one day, maybe as 2 batches on separate dates. That is also a possibility, because we have around 200 plus diploma family medicine students giving the practical exam, possibly by around March or April, I suppose. Expect the practical exam by March, because once your theory exam is done in December, you will have your results in February, and most likely you have the practical exams by March. That is the tentative way DNB things happen.
So can diploma family medicine join SR in medicine or only family medicine department? Depends on the policy of the hospitals in Delhi. Most of the hospitals will take you, non-teaching hospitals will take you as senior residents in medicine department also. Or any department rather.
So the language barrier you have mentioning about the practical examination, yes, that is the current scenario in DNB also. If you are not thorough with the language, you will have a translator. That is the policy being followed in DNB exam also. The same applies to diploma exams too, if you have a language barrier.
But most important, I wish to advise you are my best wishes. Also, that be confident when you are going. You don't feel defeated before your examination, because many of you are writing examination after long gap of your MBBS and all. Also do some practice of writing. This is very basic, that when you start writing examination, divide your time properly for each of the question. It is very, very important to attempt all questions, touch all questions. Most of the time you will be knowing all questions, but many times we focus on, we spend 1 hour in, writing 1 or 2, and then at the end of it, you see only half an hour for 4 questions. So be, mindful of using your time, dividing your time, use your clock in a way that, you divide your time and you have some time towards end of your, answering 10 minutes before you have to finish it. You plan your writing like that. Also do some practical writing practice, just for long answer short questions, so that you have ability to move your pen and finger, because writing a prescription is different from writing an examination sheet. And be confident, most of the people you will pass. Don't keep negativity, or think that I'm not prepared this time, I'll try next time, something like that. Give your best this time only, where all your possibility within 2-3 months, whatever you can prepare, you give your best and then go for examination and pass.
Yeah, the point which sir highlighted now is very important. You, as I just mentioned, you have 180 minutes for giving 10 questions, which means 15 to 18 minutes is what you can spend for one question. You can't afford to take anyway not more than 20 minutes. You can't take. That is the maximum you can afford for one question. Okay, so you have to plan your writing accordingly, and it's very important to attend all the 10 questions and the sub questions. You should be answering, because every half marks there counts that you get for the sub questions count.
Yeah, just to add to that point, even if you write an elaborate answer for each question, there is a maximum of 8 or 7 or something that you can get. So don't spend more than 15 minutes per question, but you may get something in every question and not full marks in any question. So be smart when you answer the paper.
The idea of National Board is to standardize all examinations. So this is National Exit Examination, and the idea is to give every candidate equal opportunity of passing. So although we may, have heard stories about, previous experience or, decades back experience of National Board examiners, but now the idea is to standardize. It is not examiner dependent anymore. It is your performance which counts. If you are able to cover up 60-70% of what you are expected, you'll pass. And you do not have to top it, the best part of it, you just have to pass it. I think we are done with there are no questions.
Yes, sir. We have done with the questions. So I think we can wind up. So before that, I would like to thank Raman sir for taking up his precious time for us, for enlightening the diploma students on
So
the first
I
batch.
think there is one good suggestion: organize a rapid revision for theory classes. So maybe you can look at the curriculum, and maybe 3-4 days, 5 days, 8 hours a day, something like that, or weekend programs or something like that. We can, if we can have faculty, we have sufficient number of faculty and teachers, a lot each teacher something, and if we can do cover 20, 30, 40 topics, or maybe 50 topics, it will helpful to the PG students. And if you record it, it will be a permanent resource for future. You can draw faculty from AFPA all over India, those who are trainers. And if you can do that on behalf of PG, forum and also Spice Route, that would be a great help to the candidates. Maybe you can think about it.
Okay. So thank you, sir, for accepting our invite and spending your valuable evening for us and enlightening all the diploma students who have joined. We had around in YouTube and Zoom, we had around 150 candidates attending the session. So I hope it was a much needed one that it shows, and hope they have got an idea of how to prepare for the exams in next 45-50 days, suppose. And thank you all the residents who have joined, and I would also like to thank the National Chair and Secretary of Spice Route India Movement, Dr. Zaren and Dr. Jyotika, for your support.